Good morning, Virginia. This is Virginia This Morning.
This segment sponsored by InControl Medical.
All right, 2 out of 3 women have never talked with their doctor about what's often treated like a taboo topic. Urinary incontinence Dr. Board Clary joins us this morning because there are options out there for treatment and virtually eliminating the issue. Thank you, sir, for coming in.
So thank you for having me.
You know, we were talking 2 out of 3 women have never talked to their doctor. How prevalent is this problem to begin with?
Incontinence is very, very common among women. By the age of 50, half of women have incontinence. But even 1 in 4 female college athletes leaks while she's doing her sport. So not just a disease of women who are over the age of 50, but of all women.
So we're talking about a lot, and then a lot of them haven't even talked to their doctor. You mentioned college athletes, you talked about women over 50. Is there a certain type of woman that is going to have this problem more than others?
Well, so certain things predispose you to this. Things like smoking, heavy lifting, chronic problems with your bowels, for example, thyroid disease, diabetes, etc. So lots of risk factors, but one of the biggest is childbirth.
Yeah. Oh, okay. Yeah. So if they're mom, they got an increased chance of having this problem.
Absolutely, yeah. And so this is a condition that's affected women for ages, and a lot of women in the past thought this was something that they just had to live with. You know, that as you grew older, this became part of it and of life, and you're looking for every restroom, trying to keep the bladder empty. And the great news is that there are new things that we can do to treat this across the board.
Well, you know, it is amazing that the technology that's available nowadays. All right, so let's talk about the options that are available now, because I know you brought a tool that you're using all the time. How much has this changed in, say, the last 10 years? So
it changed dramatically in the last 10 to 15 years. Mm-hmm. It used to be a large surgery was really the predominant choice, or some medications with a lot of side effects, depending on the type of incontinence. And there really are 2 types, urge and stress. Today, we are moving to more minimally invasive options, which are outpatient surgeries, or even things like this InTone, which is a newer device, which is a home physical therapy model with incredibly high success rates.
All right, so it's a home unit. How does it actually work?
Great. So it used to be we would send people to physical therapists, and you go to a very clinical setting once or twice a week, and they would teach you how to do the Kegel exercises that all women have heard about, where you squeeze and try and tighten those muscles, like if you're trying to stop the flow of urine. Kegel exercises in studies only are successful about 20 to 30% of women.
Not a good rate.
Not a good rate.
Yeah.
What InTone does is it's a device that lets you go home and measure how strong you squeeze. Mm-hmm. It also gives you biofeedback, so it tells you what you're doing and how you're doing. And then it also can provide electrical stimulation, which is a little electrical current to help contract muscles that you didn't even know you had or contract. And as a result, it has a very high success rate. And the company believes in the product to the point where it is the only incontinence treatment that has a guarantee on the market, which is interesting.
So we knew the exercise is 20 to 30%. You said very high. What percentage,
right.
basically, ballpark are we talking about?
So the company gives a guarantee if it doesn't work within 12 weeks, they will refund the money for the device.
Wow.
And at this time, more than 90% of people are not seeking out that reimbursement. So indicating or suggesting that it's a very high cure rate. And they don't want me to talk about the specific number, but it's much higher than 90% are happy with the device. And again, something you can do at home, which is a big change from what we've done in the past.
Thank you, Dr. Boyd. Really appreciate this. This is good news for ladies and moms. Learn more about the InTone Connect with Dr. Clary and OBGYN Associates, 7601 Forest Avenue, Suite 228 at Henrico Doctors Hospital Medical Office Building right here in Richmond. Call 741-0440 or visit online, InControlMedical.com. Now let's get over to Greg.